Such a pleasure to be here. Christine is amazing. Actually, this whole panel is amazing, Tom. Back to Nathan's case, I walked in the laser center one day, and this patient was sitting there, and I said, "Oh, you must have had full-face resurfacing." She says, "No, I had PDT, and they said I wouldn't have any downtime." And she looked like I had done triple pass resurfacing on her. She ended up hearing well, and I said, "Don't worry, you just got the cheapest CO2 resurfacing ever." And she did great. So I'm going to talk about, so my title is Resurfacing Cases with Infections, because I thought I've had so many people in the country send me some problems and want to know what to do and why is this happening, that I just turned this into this discussion about that. But the bottom line is, yeah, I got some horror cases, but if you do enough of this, shit happens, and that's pun intended, and that's where I'm going to go with this. So this is not advancing. So sorry, that's why it's not advancing. Nobody pays you to give a talk on complications. Okay, so no good deed goes unpunished. That's the message here. I offered a really good friend a great deal, fellow discount, big discount. I agree on the perioral. She wants to do just the perioral. I say that's fine. We apply the topical numbing. We only even number in the perioral region. But she does so well that I let the fellow do the entire face and neck. So we actually added some numbing on and then just kept going. But she didn't really have that much numbing. That was not the issue. The fellow does a fabulous job. This is not the fellow's fault. And she does great for 3 days. But the problem is she's a really good friend of mine, and she loves me and doesn't want to bother me over the weekend. So she waits till over the weekend on Monday when the shit is literally hitting the fan, and gives me a call, and I said, "Oh my God, come in." So the other caveat here, and this is what I say, and I know this is gross, but this is what I say. Dogs and cats lick their butts. Then they lick their fur, and then they climb on your couch or in your lap, or in one of these cases, sleep on your arm. And so remember that everything in your house where your animals or pets have been, they're covered with E. coli, Klebsiella, whatever else. And the second thing is, young children do the same thing because they stick their hands in their pants and diapers. So this is my resurfacing patient. Here she is pre-op. She's 1 day post-op, 2 days post-op. Everything's fine. She has no pain. But on the third day, she has pain. Does not call me, doesn't want to bother me. So here she is 5 days post-op. And now she's getting uncomfortable enough that she's bugging me. And so I'm assuming right away a bacterial infection. I do an aerobic and an aerobic culture. So tip number 1, always do an anaerobic culture, because in a minute I'm going to show you how that saved my butt. That wasn't pun intended, but you get it. And then always do a viral if it remotely looks like it could be that. And I agree with the previous couple people, everybody goes on antivirals, even if they've never had a herpes infection, because a very first herpes infection is the absolute worst one yet, and you don't want that to be on this open skin. So I did a culture, started Cipro. By that night, she was out of pain. This is the next day. So she's already significantly better. Her upper lip looks way better than it did before. But she's itchy on her forehead. And so I'm like looking at her and I'm like, we didn't really resurface your forehead. And I'll show you that in a minute, actually. So I started her on itraconazole. And so here she is that same day that you just looked at, so day 5 and day 6. And so 1 day after, she's in way less pain, redness is better, and swelling. Oh, so this, I'm sorry, this is when she gets itchy. And so now you're seeing on this next day when she comes in, where we didn't resurface, red bumps, but also she's getting redder in areas on her neck. So we start her on itraconazole. So here she is day 5, which is that first picture, day 6, where the bacterial infection is getting better, the yeast infection's coming in. Day 7, where the yeast is starting to clear, the Cipro is still on board. So it's not a drug eruption. Because one of my docs that was with me said, well, maybe this is just a drug eruption. I'm like, she's still on Cipro. Like, I don't think so, because the yeast cleared her up. 8 days post-op, everything's looking better. Here she is 11 days post-op. She has absolutely no symptoms. She's way better, no pain or itching. And here she is pre and then 29 days post. And I put this up because the thing about bacteria is they tend to eat in. And some of my fellows said I have to do this. Think of those bacteria diving in where there's no barrier. So there's no barrier, there's lots of good food for them, so things will go deeper. So what you do here is, and actually I did it probably in the week before this, is start with pulse dye laser, low dose, and I probably even did it at the first week appointment, because you can really calm down the inflammatory process that's going on. I think we potentially kill some bugs, and I'll be generic on the bug thing, but you definitely will help the redness. So stay on it, go low dose, jump in quickly whenever you think a problem. If you ever see any sort of a weird eczematous reaction post-resurfacing, it's almost always incipient scarring. It may be just a contact derm, maybe something else, but it always calms it down. And then here she is 9 months post, and so she ended up doing great. This person, I'm at Hawaii Derm, Maui Derm, one of them, and I come home and I see my patient who I did a couple days before, literally on, it's like day 3, I think, they did only an aerobic culture. I see her the next day, I see her, I guess, on day 9, and she's getting worse and worse. And they didn't start because the aerobic didn't start antibiotics because the aerobic culture was no growth so far. Of course, she's on Doxy, because we do put people on Doxy as well as valacyclovir. And then day 13, she's a lot better, but what she grew out, wait, let me just go there, yeah, Peptostreptococcus. So it's an anaerobic infection. It's been eating in, and so I lasered her to try to slow everything down, lasered her again, and she got better. But that was a very scary one, because when you see something that's eating in like that, it's like going in. It's trying to hide from the oxygen. It's going down into like...
Susie, if I can interrupt 1 sec.
Yeah.
Do you PDL over the open area, or?
I do now.
Okay.
With her, I should have jumped in sooner, but I was just sent the most horrific case, but I don't have permission to show it. And I think when I did the pulse dye laser on it, I actually helped stop the infection a little bit. So I think that the high energy pulses, they're also like, but yes, I would have jumped in there, and I might have on day 15. Oh yeah, I did on day 15, and I did on day 9. So I mean, I'll go in, but you want to go really low dose. You're really just trying to calm it down, and then we stuck with her. So this patient is still my patient, and it's over 10 years later, because I forget who just said this, stick with your patient. Don't ever let them get away. If you can't do it, phone a friend. Find somebody to help you. And this is another one. This woman is a rhinophyma, so I went pretty deep. But she all of a sudden had increased pain. Within 3 hours on Cipro, she was better. She grew out Serratia marcinens. She has pets and animals. She has a sister who also had a rhinophyma, and the reason she did her rhinophyma is because I had done her sister's rhinophyma. I did her sister's rhinophyma because I had done this one's rhinophyma. She also got infected, and they always get infected on every little thing, so I sent them for an immune deficiency workup, and neither of them has IgA. So you can actually diagnose, you can be a real doctor sometimes. This one, my Kathy, who's my nurse that many of you guys know, who's an amazing person, she should have gone to med school, does your regular 1927 fractionated laser on her, does pre-treat some areas with Q-switch, because again, if you don't kill if you have a brown spot that you can draw a circle around and give a name to, it's going to come back. So we tend to pre-treat that. She was doing fine, and on day 3 to 4, she started having pain. And then she called up, and bottom line, we did a culture. She grew out Staph aureus, but she woke up on, I can't remember if it's day or 3 or 4, with her dog asleep on her arm. So you can see here, typical Staph aureus. She spent 4 days in the hospital on IV antibiotics. But the good news is she ended up doing pretty well. If you look here, and actually I'll show you here, her hands, I mean, they're still red at 20 days post-op, but we pulse dye laser on this day. This is actually a very recent one. And then here's the arms. So she probably got a way better result than we ever anticipated, but probably not worth the 4 days in the hospital and all the trauma, and poor Kathy was a wreck. But it was nothing Kathy did. It was just infection. So, and I said to Kathy, did you tell her about the dog thing? And she goes, yeah, but you know what? I think I'm going to start telling people that dogs lick their butts. Because they don't think it. They think their dog doesn't shed hair. Their dog is fine. Their dog couldn't possibly have anything wrong. So bacterial infection, risk factors, we know about prolonged adhesive adherence, immunosuppressive medications. The number one thing is give 0 pain meds to any of these resurfacing patients, because if they are in pain, there's something wrong. It doesn't hurt otherwise. Know what the susceptibility for things are in your area. In our area, almost always Cipro has the highest sensitivity for most of these bugs. So I jump in with that. I tell them it's a black box warning. And there's actually been a case of toxic shock recently as well. So I mean, these things can be pretty serious. The main thing is early intervention. Phone a friend if you don't know what to do. But don't do what this person in our neighborhood did. She said, don't tell anybody that you've had a problem, but then didn't see her. So she ended up on my doorstep because her primary care said, go to this lady. And she lost her lawsuit case. Because unfortunately, I got to be an expert witness, but I was also the treating physician. And so I will not defend abandoning a patient. And she's not even a derm, so don't worry. Candida can be very subtle. As soon as they're itchy, they get red, they get satellite lesions. It can be slow to heal and itching. You can diagnose it. To be honest, I just treat for it. In fact, I prophylax it for it. Because the people who tend to get infections, or yeast infections, know. So the bottom line, things can go wrong, but you can still save yourself and the patient. Anticipate problems. Use hypochlorous acid spray. That has really been a game changer, especially for arms, chest, and neck, because clothing touches there. And I think it's totally decreased our infection rate. Plus, we also tell them about dogs and cats. Look for complications. Don't tolerate any pain at all. Get culture and culture everything, and treat complications as soon as aggressively you can. Thank you very much.
Thanks.